And we are so grateful to Dr. Liz Marder and Dr. Marian McGowan. Both are pediatricians, and they are or have been the chairs of the UK and the Ireland Down Syndrome Medical Interest Group. And we really would like to thank both of them for filling in this void. And like as I said, you can be rest assured you will not be disappointed. I leave it to them to say more about what they're going to be talking about. Thank you.
Marian has also alluded to the fact that yesterday, as a curtain raiser to the main Congress, there was a smaller meeting for healthcare professionals, doctors and other professionals. And the inspiration for the talk today came from a young woman called Jasprit Kaur Sekon, who gave us a very impassioned address about the things that people with Down syndrome need but sadly don't always get from their healthcare professionals. She explained to us how she and other people with Down syndrome would like to interact with their healthcare professionals, what they feel they have a right to obtain from them, and mentioned some of the things that unfortunately don't always go quite right. So Liz and I took this away and reflected on this last night, and what we're going to talk to you about today is how to promote health and well-being for children and adolescents with Down syndrome, because professionally Liz and I come from a background of working with people under the age of 20, we're paediatricians, but in fact there are general principles and themes within our talk which can apply equally well to adult people with Down syndrome. So this is the politically correct version, the title of our talk, if you like, but the alternative title is How to Get the Best Out of Your Doctor, because we recognise that that may not always happen, but we're hoping to give you some tips. So, thinking of doctors, and by extension, other healthcare professionals, what might you, as people with Down syndrome, or family members of people with Down syndrome, reasonably expect that a doctor might be able to do for you? So there are a number of ways in which doctors can get involved with your lives. Your doctor should be in a position to help with making the initial diagnosis of Down syndrome at the beginning of the life journey. Your doctor should be able to provide you and your family with information about Down syndrome, to tell you about screening for medical problems that may emerge, which might not always be readily apparent, to make diagnoses of medical problems if a person with Down syndrome does suffer for them, whether are problems that can be cured or treated to offer the appropriate treatment, and if somebody has a problem which isn't going to go away, your doctor should nevertheless be able to help you with managing those symptoms and making them more bearable and more acceptable. So that all sounds very fine, and these are the sort of things you might expect your doctor to do. But sometimes it doesn't quite happen. And so, what makes it go wrong? What are the things that can go wrong? Well, first and foremost, although we know that Down syndrome is a big problem worldwide, and that there are many people who have Down syndrome and who may have medical problems that are attendant on that, the reality is that your average doctor may actually not have that much experience of Down syndrome. He or she may only interact professionally with a few people who have Down syndrome, whereas he or she will probably be seeing many, many more people who have other conditions like osteoarthritis or heart disease, and so they have limited experience. Because of that, it is also a fact that there is not that much training in the medical school curriculum about Down syndrome. Doctors train for quite a long time, but they also have to learn a lot of things. My paediatric training as an undergraduate was 6 weeks, and that had to include everything to do with children, plus Down syndrome. So you can probably work out how much of a look syndrome got in the curriculum. And it's not always very easy for doctors to know where to go to get the information they need. Medicine isn't a static entity, it moves on, new discoveries are being made all the time, but even though you think your doctors have been trained in this, it can be quite difficult for them to get to the information they need, and they can get out of date, unfortunately. There is not as much research in the field of Down syndrome as we would like to see medically, and because of that, we don't always have very good evidence about what works and what doesn't work. We don't always know what are the best treatments to offer people. And sadly, at a national and global level, although there are many people in the world who have Down syndrome, there are more people again who have conditions like HIV/AIDS, who have conditions like people lose confidence in their doctors, they assume they won't be listened to, and they don't go and see the doctor. And they feel that really the doctor is not treating them with the respect that they deserve. And they may feel that their doctor is really not going to allow them to get involved in their treatment and to make decisions. So we need to change that. And what Liz and I are hoping to try and discuss with you is ways whereby we can change this problem. So we need to ensure that there is a greater awareness among the professionals of the sort of medical problems that can be associated with Down syndrome. We need to work on implementing programs and putting in place guidelines that will help to ensure that problems are identified. We have to work with the professionals, not against the professionals. Getting into confrontation, tempting as it can be sometimes, is generally not a good idea. We've seen that our professionals can have difficulties. It may be good to try to support them and help them to know where to go to get the information that they need to improve the standard of the care they offer. So I'm now going to hand over to Liz, who is going to tell you a little bit about how we've tried to make a start with this in the UK and some of the things we've put in place.
Okay. So the Down Syndrome Medical Interest Group is a group of health professionals in the UK and Ireland, and our aim is to make sure that we have equitable provision of medical care for all people with Down syndrome in our areas. We've been going since about 1995. We now have over 150 members, and it is only open to health professionals. The members come from predominantly the UK and the Republic of Ireland, but we do have members from 18 other countries. And we are mainly paediatricians, which is an issue that I'm sure we'll debate again and again during this week, is that engaging our adult colleagues has not been easy. We have our own members' meetings twice a year, and those days we choose a topic that we want to discuss. And the way we structure the meetings, we often choose, say, right, we really want to know about epilepsy and Down syndrome, and we look around and say, is there an expert in epilepsy and Down syndrome? And usually the answer is no. So we go and find somebody with an expert in epilepsy, who's an expert in epilepsy, and we say, look, we know about Down syndrome, you know about epilepsy, let's work together. And in that way, we've actually got quite a lot of specialists to come into thinking about Down syndrome, so it's a model we really like. Occasionally we'll have a much larger meeting, one where that'll be a national meeting, where we'll invite people from external speakers. We also run an information service, which is based in my Child Development Centre in Nottingham, where we have a member of staff who is paid by us, who helps run a database of specialists that we know have an interest in Down syndrome, helps with maintaining a library, but most importantly helps with individual queries. And we are working extremely closely with the UK Down Syndrome Association, which I have to acknowledge are our main source of funding. And we provide the medical information service for them, so to speak. So we work very closely together, that they deal with queries they can deal with, we deal with the queries that are either beyond their expertise from a medical point of view, or specifically from health professionals. We have a website, which I would encourage everybody to look at. Everything on there is freely downloadable, except a small closed members area, which the health professionals may also be interested in and may wish to join. Most importantly though, we've developed some products which are about achieving all the aims that Marian's just talked about, and these are our evidence-based surveillance guidelines and our parent-held record insert. Just to talk a bit more about those things in detail, on the website we have a library where all the information resources are. We have information about the products we've made. We have book reviews. We particularly identify right the way through the website resources that are suitable for parents. We say very clearly that we are not a website intended for parents, which is why we choose some information that we think professionals may wish to share with parents. We have information about all our activities and our own members area. And these are just what pages look like from the website, in case you haven't looked at it, though it's likely to look different in the fairly near future because we're upgrading it. So, we've managed to provide a fair amount of information for health professionals. How do we make sure it reaches them? And I think most of you in the audience know what the best way to reach the health professionals is, and that's via you. That's via the parents, the carers, the other professionals working with people with Down syndrome, and the people with Down syndrome themselves. And I was struck, I think Marian didn't tell her own story, so I'll tell it, that I didn't realise until today that the only reason she joined our group 17 years ago is because we were organising a big conference in London, and a parent came into the room to see Marian with a flyer and said, I've seen this conference advertised, I was thinking of going, but I think it's really for health professionals, why don't you go? And here she is 17 years later. So that's, parent power, it's you who have the motivation, and you who often have the information. So what we have is the parent-held child health record, personal child health record, which is a UK product that every newborn baby in the UK gets given this when they're born. And it has information about that a new parent needs to know about immunisations, growth, feeding, who your health professionals are, etc. And what we've done is we've made some special pages about Down syndrome to go into it. So if you happen to have a baby with Down syndrome, you get your parent-held record with these extra bits. So general information about Down syndrome, expected developmental progress, health problems, suggested schedule of health checks, advice on immunisation, feeding and growth, and Down syndrome growth charts. And you can hear about some of those things in our presentations later on in the week. And this is just the page of the health checks. The other thing we've done is we've made our guidelines, and our guidelines are different from the guidelines that you'll hear presented by Professor Puchel in a minute, in that we don't talk about what you should do at different ages for children with Down syndrome in general. We've gone into the evidence in each topic area in a great deal of detail. So for each topic area, we've looked at all the evidence there is, we've made some recommendations, and for the health professionals' use, we have referred them to where we got our evidence from and why we've made those conclusions. And we have guidelines on cardiac conditions, cervical spine instability, thyroid disorder, vision, hearing, growth, and we are planning one on the newborn care, and future we hope to do ones on management of infection and sleep-related upper airway obstruction. They're all downloadable from the website, and just quickly, the sort of things I'm going to race through this. The guideline starts with some background to make sure that somebody who's totally uninitiated knows that Down syndrome may be associated with heart disease, and then we make statements like, you must know whether a child with Down syndrome has congenital heart disease by 6 weeks, and that's an absolute rule in the UK. You must do a neonatal examination and a check, and then we go on to tell doctors the sort of tests they might do, and what we've tried to do in these guidelines is we've tried to make them applicable anywhere in the UK or Ireland. Now, I appreciate that other countries may not be able to do this, but any baby with Down syndrome should be able to get this service. And we tell doctors what to do then. We also tell them what to do if the Down syndrome is not diagnosed initially, or somebody comes into the country unscreened. And they can then go away to their own health authority and say, look, this is what DSMIG recommend. We have to do it, and people have found that very useful. We have the same for all the others, so the ophthalmic one, again, tells you what might be problems, and then says you must check a new baby for cataracts, you must monitor in the first year to check the baby can see, they must see an ophthalmologist at 2, they must have their vision tested every year, and throughout life, at least every 2 years. And each of our guidelines has that kind of information, and if anybody's interested, then please look at our website. They're all freely downloadable. They've all been updated in the last 5 years, and a lot of them have just been updated in the last year, so they do have recent information. Just to conclude.
So to conclude, ladies and gentlemen, what can you do? Please remember that your doctors are human, just like you. They may not think they are, but I'll tell you a secret, they are really. And how do human beings behave? They respond better to praise than to blame. We all actually like to be liked. So even if you think your doctor isn't doing an awfully good job, try to get alongside with them, be helpful. I am so grateful to Philip's mum for having got me to go to that conference all those years ago. I'm not in touch with them anymore, sadly, but thank you, Philip's mum, Lois, for doing that for me. Give them the information, but give it to them in the right way, the way Lois did to me. You know, I think you'd like this. And work in partnership with them. If you go 51% of the way, they may well come the extra 49 and you'll meet in the middle. Thank you very much for listening.